Well, hello and welcome to Ask the Doctor. My name's Jerry McGee and I'll be your host for today's show. We're here in Pittsburgh, Pennsylvania at Wellness Associates with Dr. Eugene Goldberg. Dr. Goldberg, thank you very much for your time. On today's show, Doc, we want to cover this topic of headaches. Okay? And it was interesting as I was preparing for our show today, I was watching TV and there was this commercial came up and said, if you have a normal everyday headache, take X, Y, Z. And my thinking after, discussing and talking with you on all these problems we talk about, I'm thinking, why are we classifying it as a normal everyday headache?
I'm not agreeing with that because to me, I don't have headaches, so it's not normal to have headaches. If you're having a headache, it's for a reason, and you need to listen to your body like a red light on the dashboard and find out why you're having a headache. See, the thing, Jerry, it's ironic, the brain cannot feel itself. The headache's not coming from the head. It's 9 times out of 10, it's coming from the upper cervical, which is the bowling ball, your head, resting on the pull cue. The problem's with the pull cue. So what we've been doing the last 30 years, Jerry, is adjusting the C1 or C2, which is the atlas and the axis, and 99 times out of 100, that's the cause of the headache. And if you adjust C1, C2, they don't need aspirin. Nobody has an aspirin deficiency, Jerry. There is no such thing.
And I think, a lot of these drugs that people are taking, it's almost, they're so used to trying to mask these symptoms. I don't know if they understand what that's actually doing to your body by taking in all this stuff.
My understanding, Joe, I'll just tell you this, I just heard this recently. Half of people in the country that take aspirin, they have a negative effect. It can cause heart attacks and strokes. Now, the half of people that take aspirin, they're great. The other half, if you're in that half, aspirin can actually cause your stomach to bleed. It can actually cause stroke. It can actually cause heart attack. This is what we're finding out.
Yeah.
So therefore, if you're that 50% that's having a headache and you're taking aspirin, God bless you. Good luck to you.
And now I think it's because some of our people might be saying, well, my doctor told me to get on 1 aspirin a day. Okay? And is this different? Now that dosage, by taking that 1 low dose aspirin, that's different than what we're talking about with taking 3 and 4 at a time.
At one time, people were popping adult aspirins, and they were 50% of them were dying until they finally says, we can't kill half our patients. We have to knock it down to a baby aspirin.
Yeah.
So therefore, you got to realize you could be in that 50% that it's going to help you, and the other 50%, you got to watch it.
Now also when we're talking about headaches, because there's a lot of different causes, or can have different causes for this. So what can you tell our viewers about, like the allergies and the sinuses and all that?
My understanding is probably like a third of the people, in my experience for 30 years, it's coming from the atlas and axis. Another third, it's a sinus headache. So therefore, you have to work with the acupuncture points on the sinuses, relieve the blockage, which helps that nerve, it helps the circulation, helps the energy flow, which is your meridian. 3, Jerry, believe it or not, there's 500 nerves that come down from your brain and go to Grand Central Station. It's the TMJ. So if your TMJ is out of alignment, it's pressing on those 500 nerves, you're going to know that's a very painful thing. So what we do, Jerry, the good news in the office is we can actually adjust the TMJ. I just did that this week on this woman who came in, and we're tremendously helping her. So it's something simple.
Now also from a, we can throw in this stress problem, the upper,
Traps.
How stressed out people are and tense and
Tension.
body position at working. So what can chiropractic do for that?
Well, if you have an attention headache, we can do trigger point therapy, we can do massage, we can do physical therapy. It's very important working with the traps because everything has a tendency to get traps. The shoulders, just so you know, can refer into the neck, which refers into the head. So it's all connected. People think it's just one cause, one cure. We're really a single synchronized functioning unit. It's many causes, many cures. So what we do different, we're doctors of cause. We find out to the cause of why you have the symptom. We don't mask it with drugs. We actually try to correct it. We try to fix it. We don't want to just treat you, Jerry. We want to correct you. We want to fix you.
Along those lines, I read a very, what I thought to be a very interesting quote online the other day. And I want to make sure I get this correct. It said, chiropractic is not actually a therapy or a treatment, but rather gets to the cause of the problem, thus allowing the body to affect a correction that lasts beyond actual care.
I love it.
I thought that was a very interesting way of putting it.
That relates to our philosophy that the body does heal itself, that the default setting of the human body is health and wellness. If you're sick, if you're in pain, that's not normal. So people like in sick and pain, they think it's normal to be in sick and pain at 40 years old. Okay? See, to me, if you're in pain or you're sick, you want to come into the office and we can find out exactly what causes your pain or why are you sick. Okay, that's what we do differently, Jerry.
And I think there's so many people today that are just kind of, have been walking around in this haze for so long, they almost don't even know what feeling well is like.
So they're so screwed up, they don't even know they're screwed up.
Yeah, their normal has come down to this, oh, that's just the way, oh, my doctor says I'm getting old, that's how I'm supposed to feel.
But see, my answer to that is you don't lose energy because you get old. You get old because you lose energy. How do you lose energy, Jerry? Your diet, your lifestyle, your nutrition, and your structure. So when you can come in, hopefully we can do all 4 of those cylinders of the car. Your body's the car, okay?
And I also like on your website how you have that quote about the best cure for any disease is to just get healthy.
That's right, because you can't be healthy and sick both at the same time. See, right now, as we're sitting here, Jerry, I'm healthy. So if you call me at 5:30 today, you ask me how I'm doing, I'm going to tell you I'm fantastic. Why? Because I'm healthy. So if you're healthy, guess what? I can't get sick. Is this a revolutionary thing?
Well, unfortunately, a lot of the people are just so used to this
Medical model.
Yeah, I mean, we've had it for so long, and it's just been programmed in, and that's why I'm hoping that these shows are helping to educate the consumer out there that, one, there are some alternatives. If you're truly going to get healthy and live a long and healthy life, you've got to take responsibility for yourself.
Right. I was watching Dr. Oz the other day, I'll just mention this, and they had Dr. McCullough on. He's like one of the leading alternative practitioners. And Dr. Oz said there's actually a civil war on right now between traditional medicine and alternative. And he's saying there needs to be a dialogue between the two sides because the public out there, they're going to benefit because now they have access to information. It isn't you just take drugs and surgery for everything. Again, it relates back to the many causes, many cures. And we try to find what's causing your problem. It could be anything. Anything can cause anything, Jerry.
Yeah.
And the good news is anything can cure anything.
Yeah, I love watching Dr. Oz. I mean, I think he's one of the few medical doctors that I know that really looks at
everything,
all possible things. Offers some great, homeopathic remedies that that people can use. Doesn't recommend taking all these drugs. I mean, I think he's one of the guys that gets it.
I'm understanding homeopathy at the turn of the century. That was the main medicine. That was the true medicine. Okay, until allopathic. Did you ever hear allopathic? It means all pathology, which is everything's drugs and surgery. See, homeopathic, naturopathic, that used to be the main healing methods in America in the year 1900. Only 5% of Americans were sick in 1900. You know what it is now, Jerry? It's 53% and counting.
Yeah.
So maybe it's time to change the prescription.
Yeah, well, I would think so. Now, one other thing that I want to talk about with headaches is this thing called migraines. What can you tell us from that standpoint?
Migraines, of course, is a very serious thing. I'll just tell you a little anecdote. Recently, we had this woman. She's 36 years old. And she's had headaches, migraines, since she's 18 years old. So she's been suffering for 18 years. And she had a couple visits, and she went up to the front desk, and she was telling everybody that she's 80% better in like 2-3 chiropractic visits. Why? Because we got rid of the cause of her problem, which was her subluxated atlas. So if you find the cause of the problem and you correct it with a specific chiropractic adjustment, she's coming in tomorrow, and I know she's going to tell me she's great.
Yeah. Okay,
she's only had a few treatments. She's 36 years old. She knows she's headache-free. She had migraines for 18 years, Jerry.
That's an amazing stat, because I know, some people that have migraines, and dealing with that is
it's usually women, and it's a very debilitating thing. She can't work. Then one day, first day she came in here, she couldn't work. They get nauseous. Okay, they get a halo. They can't drive a car. They're in bed.
Yeah.
Usually men don't get it. I never had a migraine. Usually it's the women that get it, unfortunately. So if there's any women out there, you're having a migraine, check out some change of the prescription here.
Yeah. Well, and I think if you're watching this video, and even if you're dealing with these so-called normal everyday headaches, one, they're not normal, so you need to look at what the cause of those is. So even if you're at that level where it's something that you've been dealing with, really hasn't been that debilitating, but chiropractic care can still have a major impact on curing that problem and helping you deal with that much better, all the way up to this migraine. So it doesn't matter if you're at the low level or the high level, chiropractic care can do a lot of great things for you. So we encourage you to pick up the phone, call Wellness Associates, check us out on the website. We've also got a great new Facebook page. I know a lot of you might be on Facebook, and Dr. Goldberg's up on technology. So you're going to want to check that out. You can actually schedule appointments right on there, check out some reviews, a lot of interaction. Visit Wellness TV, where you'll be able to see all these shows that we put together. Because we really want these shows to be something that you get a lot out of and that you go back to a lot,
right,
and just get educated. I think that's really what our whole goal is, is to educate people on these problems and the different types of treatment. And the great thing about Wellness Associates is they're willing to team up and work with whatever you're doing right now. So we're not telling you to do away with your doctor. We're just telling you that Dr. Goldberg and Wellness Associates can be a great add-on to the team, and together the only person that's going to, really be benefiting is you. And that's what our goal is to help you deal with your situation and live a long and healthy life. So thank you very much for watching our show today. We look forward to seeing you on future episodes. We've got a lot of great shows coming up again this month. And just be sure to check us out on the web at AskDrGoldberg.com or on Facebook at Wellness Associates. And we look forward to seeing you here and helping you deal with whatever situation you might have going on. So have a long and healthy and happy life. And we will see you very soon at Wellness Associates in Pittsburgh, Pennsylvania.